This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Thursday, March 19th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees, so our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what is going on, and we appreciate your staying with us on Africa 54. We begin Thursday's coronavirus report in China, the original epicenter of COVID-19. Today, for the first time since the virus in Hubei province city of Wuhan was reported, China has not recorded any locally transmitted cases of COVID-19. The country has increasingly focused in counter-outbreak efforts on inbound travelers arriving from abroad. The new ground zero for COVID-19 is Europe, where Italy is reporting nearly 3,000 deaths and more than 35,000 confirmed cases of the coronavirus since the outbreak was first reported in late February. There are 219,000 global reported cases of the coronavirus, and nearly 9,000 deaths are linked to the virus. Governments across sub-Saharan Africa are racing to improve their preparedness amid fears that disease could spread quickly in poorer communities and cramped informal settlements. Angela Okumadu reports.
Outside the school in Senegal's Pikine, these pupils are reciting what they've learned. It's a hasty lesson on how to prevent coronavirus. The continent is bracing for a surge in COVID-19, but it's in poorer suburbs like Pikine where the stakes are high. Promoting good hygiene is complicated here, home to more than 1 million people and where the water is frequently cut off. Kari Faye Sugu is head nurse at the North Pikine Health Center.
We always advise them to have water bottles on standby or to buy mineral water. But you know, sometimes the financial situation is not easy.
Health experts fear the flu-like virus could spread at lightning speed in poorer communities and cramped informal settlements across the region. But it's not the only cause for concern. Conflicts have displaced hundreds of thousands and destroyed infrastructure. South Sudan, reeling after years of civil war, has just 24 isolation beds. Burkina Faso, under siege from jihadist groups, says resources are lacking. Measles, malaria, and other infectious diseases have also overburdened hospitals continent-wide. In Africa's most populous nation, Nigeria, they are racing to increase the number of isolation beds, and the head of the Center for Disease Control, Chikwe Ihekweazu, says there are concerns over the capacity to deal with a large outbreak.
Our health system is not as strong as we'd like it to be, especially around the provision of clinical care.
Make sure you keep that distance.
But as reported cases of coronavirus increase on a daily basis, it's hoped that the experience of other epidemics like Ebola may prove invaluable. Bamidele Mutiu runs a biosafety lab in Lagos.
After the Ebola outbreak in 2014, a committee was set up to make sure there is a level of preparedness in Lagos State so that we will never be caught pants down.
The Africa Centers for Disease Control has been working with the World Health Organization to strengthen emergency coordination, improve testing and surveillance, and equip treatment centers. The number of countries with labs able to diagnose COVID-19 in the region has increased from 2 to 39 in just over a month. But that still leaves 8 countries without.
That was Reuters' Angela Okumadu reporting. Now, Nigeria has seen only 3 confirmed coronavirus cases so far, but people are already being told to adjust their behavior to keep the virus from spreading. Churches, banks, and other institutions are in the forefront of making changes, as Timothy Obiezu reports from Abuja.
At many churches in Nigeria's capital, worshippers are now examined and given hand gloves, sanitizers, and face masks before attending services. Church authorities say these measures became necessary after Nigeria's health ministry confirmed the country's first case of coronavirus on February 28th.
The purpose of the church is to enlighten. Is to enlighten people and help people to fulfill destiny. And that includes helping people not to be vulnerable to some epidemic. So, and that's why it's important that churches should educate people on the issue of the coronavirus.
Idai, who founded this Pentecostal church in Abuja, says they are limited in practices such as sharing communion cups or laying of hands during prayers.
Spiritual things are not carnal things. If the Lord expressly say lay hands on someone, why not? But if the Lord did not say so, in fact, the Bible says lay hand suddenly on no one.
Other institutions where people gather, like banks, schools, and hotels, are also adopting these precautionary practices. This bank is checking the temperature of every customer who comes in and ensuring that all of them use hand sanitizer.
We have all this communication even before the virus came to Nigeria. Before it was confirmed in Nigeria, they've been sending a lot of awareness stuff to us on how to prevent it, because every day we have all kinds of people coming into the bank.
Across Africa, the rate of spread of the coronavirus remains relatively low, although cases have been reported in at least 30 countries, including Nigeria. So far, Nigeria has not seen a single death from the virus. Authorities are hoping that if Nigerians carry out the preventive measures, that will remain the case. Timothy Obiezu for VOA News, Abuja.
As the rate of the COVID-19 coronavirus infections increases in Africa and around the world, experts are urging people to prepare and observe various steps, including social distancing, to protect themselves, their loved ones, and their communities against the highly contagious disease. Africa 54 health correspondent Lino Mudu spoke with Dr. Abdul Mumin Saad about how to better prepare.
Dr. Saad, thank you so much for joining us.
Thank you for having me.
There are different types of coronaviruses. Would you please give us a sense of what the COVID-19 is and how it's transmitted?
COVID-19 is one of the family of different coronaviruses, including those that cause mild illness and those that cause illnesses like SARS and also MERS that we've seen in the past. But this COVID-19 is a novel member of the viruses that was never seen in the world. It is really spread from person to person, human to human transmission by persons who cough or sneeze or exhale, and through droplets, in the droplets from the cough, sneezing, and exhalation or talking. And either the person who might get infected will inhale these droplets, or the droplets will fall on surfaces, and then the person get in touch with the surfaces and then touch face, mouth, or eyes, and then get infected with the virus.
Right now, there is no treatment, there is no prevention, no vaccine. So how are the patients treated?
You are right. There is currently no vaccine and no any effective treatment that cures the virus. So mainly, we need to understand the spectrum. A large proportion of people, about 80% of them, will come with mild to moderate infection or disease, and then about 20% will come with severe to critical condition or critical disease situation. For the mild to moderate, and it's usually symptomatic treatment, managing the conditions, making sure that people who need fluid get fluid, people who have different conditions are managed accordingly, and making sure they have adequate nutrition. And for those who require oxygen or ventilators are also provided with oxygen or placed on ventilators.
How does this affect pregnant women and unborn babies?
So we currently really don't know, because this is new, but from other viruses or flu-like conditions, pregnant women, because of the changes they have in their body, may be at higher risk of getting the infection, and they may be at higher risk of coming down with increased severity of the situation. But with COVID-19, we really don't know. And the advice for pregnant women and the unborn babies is for pregnant women to observe all the precautionary measures, the preventive strategies and advice that professionals mention about washing hands regularly, about avoiding sick people, about exercising social distancing, staying away from people as much as possible, at least 1 to 2 meters or about 3 to 6 feet.
We hear experts saying, be prepared in your home.
Discuss with your family that, okay, we have an isolation room. If any member of the family is sick, this is where the person will be. The person may have access to a dedicated toilet facility and also dedicated utensils, plates, and spoons, and what the person needs for basic living. And then identify an individual who is very healthy in the family, who can take care of the person and what to do and how to take care of the person. And of course, if any member of the family is sick, I think people should begin the isolation immediately. And this is a situation where people can use masks. Those who have suspected symptoms and signs of the COVID-19 infection should put on masks, and those who will provide care to them should also put on masks so that they can protect themselves, and also those who are infected can protect others from getting the infection. And clean surfaces regularly in the home, clean surfaces where the person is living, and making sure that it's regularly clean and maintained with regular disinfectants or detergents that are available at home. And of course, contact authorities immediately to alert them of the situation. And of course, people can recover. As we mentioned, about 80% of people can recover while at home. But importantly is that people can still continue to be infective and shed the virus, and they can transmit the virus even when they feel healthy or when they have recovered. The most important thing is for people to get tested and have 2 negative results that are 24 hours apart.
U.S. President Donald Trump is invoking the Defense Production Act, which would allow his administration to force American industry to manufacture medical supplies that are in short supply in the fight against the coronavirus pandemic. White House correspondent Patsy Widakuswara has more.
A shortage of protective equipment and medical supplies as the United States responds to the coronavirus pandemic. The country's Federal Emergency Management Agency has been activated at the highest level nationwide. On Wednesday, President Donald Trump took it a step further.
We'll be invoking the Defense Production Act just in case we need it.
The act provides presidential authority to expedite and expand the supply of resources from the country's industrial base to support national defense.
It will give priority to those kinds of materials that are needed to fight the virus. For example, masks are a concern. And if there's a mask manufacturer, the government can go to that manufacturer and say, you must give priority to production of these masks.
Trump also announced the deployment of 2 U.S. Navy ships, Comfort and Mercy. The ships are literally floating hospitals, often deployed for humanitarian assistance in natural disasters.
It has about 1,000 rooms on it. It has operating rooms. And the president is going to dispatch the Comfort to us. It will be in New York City Harbor. This will be, it's an extraordinary step. Obviously.
The USNS Comfort is undergoing maintenance and will deploy to New York in the coming weeks. The USNS Mercy will deploy somewhere on the West Coast in the coming days. Defense Secretary Mark Esper announced that U.S. military field hospitals are also being prepared for deployment and that his department will make available up to 5 million N95 respirator masks and other personal protective equipment for distribution.
The first 1 million masks will be made available immediately. Next, we are prepared to distribute to HHS up to 2,000 deployable ventilators for use as needed.
The administration plans to mobilize the Army Corps of Engineers to create new medical facilities in response to the outbreak, a plan that would need the support of the private sector.
Bringing the Army Corps of Engineers in might help increase the number of skilled contracting officers that were available and tap into assets in the civilian economy, but they don't bring any actual construction capabilities themselves.
Meanwhile, in the U.S. Capitol, metro stations are deserted as authorities urge residents to stay home as much as possible. Patsy Widakuswara, VOA News at the White House.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Still to come, survivors of Cyclone Idai in Zimbabwe are still recovering a year after the storm hit the country. We'll be back.
Chibwana chimalanda, chibwana chimalanda, ukakhala pabwino boyipa pamayitana. Chibwana chimalanda, ukakhala panchito ulova umakodola. Chibwana chimalanda, ukakhala pabanja umbeta umayitana.
As the coronavirus spreads across America, many cities are ordering restaurants and bars to stop offering in-house services. A world-renowned chef and other restaurant owners in the Washington, D.C. area are using creative ways to take care of their customers and workers and also help feed those in need. VOA's Julia Tabo has more.
This sounds like a science fiction movie, but September 11th sounded like a science fiction movie, and it happened.
Renowned chef Jose Andres is preparing his restaurants for a major crisis.
Right now, everything looks normal, right? But we need to prepare for the worst and hope for the best.
The chef is temporarily closing most of his restaurants in the Washington, D.C. area and New York to help contain the spread of COVID-19.
Yeah, so we're offering a couple items of the day.
And is repurposing the restaurants as community kitchens to ensure that people still have access to food by offering low-priced
salmon and salad.
Okay, that's good.
And even free meals to those in need.
If we are able, with these 4 restaurants I'm opening in downtown, show the way of how the restaurant private industry can be part of the emergency relief, I think in a very simple way we can keep our cities fed. The people that have money can afford to pay, and the workers can afford to be getting a little salary.
The chef will be providing bagged meals outside of his restaurants, which have been equipped with hand sanitizers and marked in ways to optimize social distancing. He says his concept can be used as a model of how restaurants can help the public if cities become major hot zones.
It's better, obviously, to have little restaurants where people will be able to have access to a plate of food. Elderly that maybe cannot cook at home. Elderly that they are afraid to go to the supermarket or nobody taking care of them, and that they need somebody to bring food to them. If we do this all across, we can be feeding one city at a time.
This Spanish-American chef is also the founder of World's Central Kitchen, a nonprofit devoted to providing meals in the wake of natural disasters. His teams work in hot zones all over the world, bringing food and relief to people in need. Other restaurant owners are also trying to adapt to guidelines while taking care of their customers and workers. Gordon Banks is co-owner of several area restaurants.
Sunday, you can ask any of my staff and managers, was a very tearful day for me as I tried to make the decision between cutting jobs and doing what we thought was the right thing for slowing down the pandemic, which was closing all the restaurants. And now we are offering takeout and delivery, trying to get 15 people back to work as soon as possible. We are profit sharing everything, so neither me nor my partner Jackie are taking any money from this. All of it 100% goes to employees.
Banks and his team have adapted, which seems to be the key during these unusual circumstances.
If we don't adapt to the circumstances that we don't foresee, nothing will happen. World Central Kitchen has proven every time that we can adapt to every circumstance, from fires to volcanoes, to political situations, to earthquakes, to typhoons, to tsunamis. That's what we all have to do, adapting, and I hope we will be able to deliver.
Julie Tabo, VOA News, Washington.
In Chinese communities across New York City, the local economy has also been hit hard by the outbreak of the coronavirus. Business leaders in Chinatown in New York have called on the government to introduce emergency rescue measures to help Chinese businessmen survive the difficult times. Here's our report.
Chin Chen Yuan is a Chinese restaurant located on 8th Avenue in Brooklyn, New York. Since Chinese New Year, business here has been relatively deserted.
Few people come out for dinner at night. We used to be busy at night, but now we have no business. We just sit there and chat.
The epidemic that has swept across many countries has severely impacted the economy of Chinese communities in New York. Justin Yu, chairman of the Chinese Chamber of Commerce in New York, said that compared with Manhattan's Chinatown, the impact on Brooklyn's 8th Avenue and Flushing's Chinatown in Queens was particularly severe.
Whether it's our supermarkets or restaurants, Chinatowns in Brooklyn and Queens, they have been hit hard.
The Chinese Chamber of Commerce of New York estimates the epidemic has caused losses as high as 50% in major Chinatown industries, such as dining, retail, and tourism. To help keep business going, Justin Yu is suggesting that Chinatown merchants adapt to the new reality.
For example, the number of dine-in meals is way down, but deliveries have increased.
Employees here say they don't have any plans to lay off staff, but if the outbreak intensifies in New York, many may have to reconsider. Tina Trin for Yi Yuan, VOA News, New York.
A year after eastern Zimbabwe was hit by Cyclone Idai, one of the worst tropical storms for Africa on record, some survivors are still recovering. The cyclone killed hundreds of people in Zimbabwe and left thousands homeless. Authorities have been rebuilding, but many are still living in temporary housing, as Columbus Mavunga reports, along the border with Mozambique.
Flooding from Cyclone Idai swept through villages in eastern Zimbabwe a year ago, leaving nearly 700 people dead or missing and destroying or damaging almost 50,000 homes. 33-year-old Muchaneta Maputire survived but had to move into a temporary shelter because his house was ruined. 1 year later, Maputire is still waiting to get into permanent housing.
What really troubles us is accommodation. When in these temporary structures, there is no development that I can do, even to plant trees. When it is raining, we fear that our structures will be destroyed, as happened during Cyclone Idai last year.
The International Organization for Migration says 24,000 Zimbabwean families affected by Cyclone Idai are still in need of permanent shelter. Zimbabwe authorities are aware of the housing problem, but say they want to first repair roads and bridges damaged or washed away by the storm.
There's a lot of work that still needs to be done, but the ministry is now leading the reconstruction and building back better than what was there.
The United Nations is managing the Zimbabwe Idai Recovery Project with $100 million in grants from the World Bank and the African Development Bank. The UN says it is helping affected communities recover through food handouts, livestock, and crop assistance.
We have started reconstruction of community roads. We have 2 roads in Chimanimani and 2 roads in Chipinge that are labor-based. So it's also in order to engage the population, engage the communities in those works. And there are a lot of assessments also that have been taking place in terms of schools, the school damaged in those areas. And what we're looking at is really building back better. So that takes also a little time, because the intention is not just repairing what is there, but really reconstructing for something that would last.
That is what Maputire and the thousands of others are hoping for, permanent homes that can withstand the cyclones to come. Columbus Mavunga for VOA News, Chimanimani District, Zimbabwe.
Here in the United States, former Vice President Joe Biden now appears to be on a glide path to the Democratic Party's presidential nomination after convincing victories in 3 state primaries Tuesday in Arizona, Florida, and Illinois. Biden has been on a massive winning streak in recent weeks over his remaining rival, Vermont Senator Bernie Sanders. The Sanders campaign says the senator will now reassess his campaign in conversations with supporters. VOA's national correspondent Jim Malone has more from Washington.
Democratic presidential candidate Joe Biden solidified his grip on the party's nomination Tuesday and also sought to reassure U.S. voters on the threat posed by the coronavirus.
We're all in this together. This is a moment for each of us to see and believe the best in every one of us, to look out for our neighbor, to understand the fear and stress that so many are feeling.
Senator Bernie Sanders also focused on the coronavirus pandemic, but said little about Tuesday's primary results, where Sanders lost in all 3 states up for grabs.
We need to make certain that everybody in our country who needs to go to a doctor can get the health care they need regardless of their income.
Biden coasted to victories in Arizona, Florida, and Illinois Tuesday in a primary race that is now overshadowed by the coronavirus pandemic. Illinois voter Dave Claywin supported Sanders.
So I'll go vote, and then I'll vigorously wash my hands afterward.
Biden turned his campaign around with a victory in the South Carolina primary less than 3 weeks ago, and he has never looked back, says analyst Jim Kessler.
And when Sanders became a serious candidate and people really said, okay, is it going to be him? They said, no, let's coalesce behind somebody. And that was Joe.
Democrats must now focus on uniting the party if they hope to defeat Donald Trump in the November election, says Professor Larry Sabato.
Bernie has to find ways to calm down the more extreme Bernie bots, as they're called, Bernie bros, Bernie bots. And the Biden supporters and the mainstream establishment Democrats have got to reach out to the Sanders people and have serious conversations with them.
Several upcoming primaries have already been postponed due to the coronavirus threat. Some states are also looking to move to mail-in balloting. Jim Malone, VOA News, Washington.
And that's our show for today. Be sure to watch Africa 54 on our website. From all of us here in Washington, goodbye.